Hello, happy Thursday. As you can see, I found one additional perspective of my living room that you guys had not seen yet, so hope you enjoy that. Let's see what we're going to talk about today. Don't have that many of these left. Very exciting. Haha. Tooth extractions. Wow. Wow. I have probably like 3 hours of video footage of me talking about tooth extractions because I had this whole video planned out like a year ago. I was working on this probably a year ago that I wanted to do on the topic of tooth extractions because part of the I don't know, like functional orthodontics, orthotropics, like worldview ideology is basically that tooth extractions are evil and bad and should never happen. And because of my own personal experience, I really bought into that for quite a long time because I had tooth extractions when I was young, like when I was 8 years old. They extracted a bunch of baby teeth, which is, you know, whatever, those are gonna fall out anyway. Not that that's not a, not that that has no effect at all, but it's less of a big deal than extracting permanent teeth, which can really affect the overall structure and function of your bite and of your face. So I had 2 permanent teeth extracted when I was a kid, and in this other video that maybe I'll make one day, I was going to put in like pictures, like before and after pictures of how I looked before having the extractions and then how I looked after, which, like, I was a growing kid, so you can only conclude so much, but it was pretty obvious that they did not do me any favors. And so yeah, well, and then I proceeded to spend tens of thousands of dollars and years of my life essentially trying to reverse those extractions, which I did finally do, which made a big difference in the overall like function of my bite. But yeah, in any case, understandably, I also had this pretty simplistic belief that tooth extractions bad. Anybody who does them is like kind of stuck in the past and I don't know, just kind of dumb or something. But in my wise old age, it occurred to me that like that kind of thinking is pretty indicative that that I'm missing something, because like there has to be some reason that extracting teeth became as common as it did. And indeed there was. Wouldn't you know it, orthodontists and dentists aren't actually just out here looking to cause problems for people. If you look back at the history of tooth extractions, there's like actually a good reason that they started doing this. So I guess I'll give like a brief overview of what I was going to talk about in the big tooth extraction video, because you would hope that at this point I know it by heart, since I tried to record this dang thing like 3 different times. The problem is it kept being too long and I didn't want to make it that long, but maybe that's not as big of a deal as I think it is. Whatever. So there's this guy named Charles Tweed, and he is widely considered to be like the father of modern orthodontics. And he was practicing in the I want to say early to mid. It's possible it's mid to late, but we'll say mid, in the mid 1900s. And he studied with this other guy named Edward Engel. And Edward Engel, actually, is it Edward Engel who's considered to be the father of modern orthodontics? Whatever, it's one of the two of them. Maybe they're both co-parents. I don't know. But Edward Engel had a very strong philosophy of orthodontics that you can only achieve optimal function and aesthetics of the bite if you have all of your teeth. So he was very, very like anti-extractions. And like the extractions weren't commonly done before that anyway. So it's not like he was fighting against a common practice. It was more just like this assumption that, yeah, obviously you need all of your teeth. So the job of an orthodontist is to just try to get all of the teeth to fit into the mouth and like keep them reasonably straight and all of that. But oh my gosh. So because Charles Tweed studied with Edward Engel, Charles Tweed also adopted this philosophy of orthodontics and was very adamant that you got to keep all the teeth. And it was only after he had been practicing on his own with real patients for quite a few years that he started noticing that the retention, like the long-term, like retention and stability of the bite was not good, which makes sense because if you have crooked teeth or overlapping teeth or teeth that appear to not fit in the mouth, they will end up in sort of the most stable configuration. And then if an orthodontist comes in and tries to straighten them, if you aren't, wearing a retainer every night, the teeth are probably going to revert back into a more stable configuration. Now, that's not always true, and especially gets more complex if you're dealing with like children and adolescents who are still growing. But in any case, he observed this. He considered it to be a problem, which in itself is interesting because with modern orthodontics, we are so far past any assumption that the teeth are going to stay put without long-term retention, like without wearing a retainer. Nobody has that expectation. Like if you get braces, they're going to tell you you have to wear the retainer for the rest of your life, and if you don't, all bets are off. So it's already interesting to me that back then they still had this apparently naive idea that treatment success would include long-term stability without needing to wear a retainer. But I digress. So, train of thought. Oh, hi. Pigeon's on my lap. Say hi, Piggy. She's been nibbling on my fingers while I've been trying to talk about Charles Tweed. Charles Tweed was a very scientifically minded individual. So he began to kind of conduct informal experiments where he would keep track of the results of his patients where he did perform extractions versus the ones where he didn't. And based on his own professional and personal assessment, including function, including aesthetics, including long-term stability, he was forced to conclude over and over again that the extraction cases actually gave a better result. Now, it is very important to contextualize this in that time period where there was a specific aesthetic preferences for facial structure. Nowadays, it is considered to be pretty, well, I don't know, the aesthetic trends have very much moved in the direction of like very full lips and more of the like, I don't know, I guess like movie star type, like robust mid-face growth, etc., etc. Back then in the mid 1900s, there was a much stronger, there was like almost the opposite. Like there was a, maybe not so much for the mid-face development. I think that is kind of through the ages, like timeless, a timeless standard for attractiveness. But the lips specifically and the relative prominence of the lips to the rest of the face, the aesthetic preferences were kind of reversed back then, where a lot of people, but especially Charles Tweed, was really not about any kind of protrusion of the mouth. And he was like that is the part of the face that he was fixated on. And if an adolescent or a young adult who he had treated and not done extractions for was left with a little bit more like protrusion of the mouth and lips after their treatment, he considered that to be a failure. So a big part of his like assessment of success or failure of cases did have this aesthetic component, which maybe at the time seemed more objective. Like, okay, everybody agrees that it is more attractive to have like a very flat mouth region, and that is by far preferable to any kind of lip protrusion. Maybe that seemed like kind of an objective standard at the time, but certainly in hindsight, we can see that that is very subjective and not necessarily aligned with optimal function, or, you know, knowing what we now know about susceptibility to sleep apnea and TMJ issues, et cetera, one could argue that it's actually objectively a worse standard, and that having a little bit of protrusion from wider dental arches and more forward dental arches, allowing more tongue space, etc., one could argue that that is just a better aesthetic standard to have, because it means you have more room in your mouth and might mean that you are not as susceptible to sleep apnea, jaw issues, etc. So, very, very interesting to dig into the history. I spent a lot of time reading the textbook that Charles Tweed wrote and looking at all of the all of the cases, and with like before and after photos, and like there was a whole cohort of patients that he initially treated without using extractions, and then when their cases failed, he went back and retreated them using extractions. So interesting to see those comparisons. From my own personal assessment, I can definitely see in some of the cases that the final result seems better with the extractions. And you can see this in the modern day, where it's certainly not uncommon for people to seek out tooth extractions because they have more of this like protruding like protruding mouth. A lot of people struggle with like having teeth that are so prominent that they like can't even easily close their lips over them. And that's a thing that a lot of people are really insecure about, and they seek out extractions and then are like way happier with the final result. But then you'll also see cases like that where people then regret the extractions because now they're having jaw issues, or now they're having breathing issues, or maybe they miss how their face looked before, even though at the time they were self-conscious about it. So it's very much a your mileage may vary situation. I obviously still have my like perfectionist, idealistic, sort of pie in the sky opinion that like in an ideal world, people would never need teeth extracted because like, duh. But in the real world, where there are a lot of different factors that can affect the development of the facial bones, which then in turn affects the ability for all of the teeth to comfortably fit in the mouth. And, you know, there were also like some other things I was going to talk about where like if you're like careful and intentional, having permanent teeth extracted doesn't necessarily need to translate into reduced tongue space or like retraction of the dental arches. If you do it without intention, those are almost always the kind of like natural consequences. But in theory, it is possible to maintain arch width and arch position even with less tooth material. You just have to be a lot more strategic about like the orthodontic manipulations and which direction you're pulling where and where the forces are and such. But yeah, definitely a theme of like aesthetic preferences masquerading as concerns over function, which then later end up not being true or accurate. And you know, like everything else, at the end of the day, extractions are a tool, and whether the outcome is going to be good or bad is going to heavily depend on who is wielding the tool and in what context, obviously. So I do feel that I personally now have a more mature perspective on extractions and am less like rage against the machine, like everybody's stupid and orthodontists are barbaric and blah blah blah. A lot of harm has come from the routine extraction of permanent teeth, certainly, but I also think that overly fixating on that can distract from the more important question, which is, why are we having so much teeth crowding in the first place? Because if you don't have crowded teeth or other issues, you're never gonna go to an orthodontist or bring your kid to the orthodontist, and they're never going to have the opportunity to extract your teeth. So the fact that extractions are common is a symptom of a problem rather than the root problem itself. And yeah, that is the reason why this has become such a widely used, if not necessary, tool. That's the more important question. And that's when you get into things like nutrition and like immune involvement, because that can affect ability to, like, overall, like, sinus and nose stuffiness or clearness, which affects the ability to breathe through the nose, which affects the development of the face. So like allergies is the word I was looking for. Wow. So yeah, things like nutrition, allergies, whether there's some kind of like other genetic or epigenetic influence that is over time causing people's faces to become less accommodating to a full set of teeth. And this is where, you know, the work of Weston Price really focuses, which is great. And yeah, there's a lot of interesting directions you can go with that question. Like the quality of food, tongue function, chewing, breastfeeding, that's a big one, because that's a big factor in like babies initially learning how to use their tongue and the muscles of their face and like training those muscles. What else was I going to say? I had something else. Oh, tongue ties, because that obviously affects the function of the tongue if you have a tongue tie. And there are, I think, nutritional connections with tongue tie as well, where I think they're more common in babies born to women with certain vitamin deficiencies. I would have to confirm that. I don't remember for sure. But yeah, many different influences and factors related to facial development that are, I think, the more important and interesting things to focus on, because if you're going to say extractions are bad, don't do them, most of the time you do need an alternative solution, because if the problem is severe crowding and teeth not fitting in the mouth, if you're not going to take teeth out, you kind of have to do something to make the bones be able to accommodate them, or ideally prevent the crowding in the first place. So that is all I'm gonna say on that topic for today. I hope everybody has a good rest of your Thursday, and I'll see you again tomorrow.